This is one of Netcare's health facilities, the largest private healthcare provider in South Africa. From advanced electronic medical records to the use of algorithms that predict patients' risk for heart failure, respiratory inability or infection, digitalization is already transforming patient care.
We do all of our clinical notes on the iPads. We've got all of your blood results, ECGs, chest X-rays. All of our consultations are done through the iPad, medication, the whole lot. And what's also part of the aspect that we do is that the nursing heart rates, blood pressures, those type of things that we in the past used to write down on a piece of paper, you have to go in, find it, go to the next patient. All that stuff is being piped in real time into our electronic medical record. So what we found is that this has freed up our nurses to spend time on the stuff that's important, which is the patients.
And the benefits are tangible.
This algorithm that we've worked on tries to identify patients who are in the process of getting sick before the doctor would clinically be able to identify this. The thought that we have is that this algorithm is listening to the patient all the time. Doctors and nurses, they're there, but they can't watch every second of every moment.
Under its G20 Presidency, South Africa is pushing for a greater focus on digital public infrastructure and AI to ensure technology benefits people everywhere, not just in wealthy nations. At Chris Hani Baragwanath Hospital, one of the largest in the world, government is embarking on a massive digital overhaul, digitizing 800 million patient records across 37 public health facilities in Gauteng. Already, more than 100 people have been employed to carry out this work over the next 3 years.
History has told us that these were the challenges that we had, silos or standalone systems, whereby Para will have his own X-ray machine, X-ray system, which is PACS, and Charlotte will also have their own. And when the patient goes to Para, they need to do MRI X-rays, then they'll repeat the same thing if they go to Charlotte because they don't have a history of the patient. So how do we trace that part? Our health information system will have those records, tracking using the patient master index number that I alluded to, then you'll be able to see the X-rays or the history of the patient. Going back to the digitization project that we're doing, the scanning the hard copies of the files that we have, those files will be available into the system where we are in the process of integrating it to the core system, which is the health information system.
But like everywhere else, going digital requires massive investment in infrastructure.
It's a huge undertaking, the devices with which you interface with the patient, the support for those devices, the background computer systems and databases that need to be on there, the work that it takes to get all of your processes digitized.
The World Bank warns that poor connectivity and lack of skilled talent still threatens Africa's ability to build inclusive digital systems. And yet, without this infrastructure, digitalization risks deepening inequality rather than solving it.
We need a stable infrastructure that provides a good speed with proper security and with instant reporting. Because I'll give an example, one of the most critical systems that are highly dependent on the connectivity is your radiology system. You're sending a lot of images, big data, and remember that we have doctors that they need to view those reports and images when the patients are there. So radiologists, when they report immediately, then the viewing doctor on the other side, they need to have access to the report of the patient. So we need a stable infrastructure that will talk to it to say that the information is available.
For the government, the end goal is a single digital identity across the health system, from birth to old age, ensuring continuity of care. And it's not just in health. In classrooms like in Diepsloot Primary School, learners as young as 6 are being introduced to coding and robotics, skills that prepare them for the jobs of the future.
Here with my learners, we managed to create something which is a tractor. Yeah. This tractor belongs to us at the school, but it was built by the learners. These learners, as you see them, The reason why they created this or they designed this is because at our school we've got garden. So sometimes it's become difficult for us to pour the vegetable with our own hands. So they, in their back mind, they thought maybe if we can create a tractor that can walk and plow the plant at the garden, then we can have more vegetable for our school.
For Africa and the Global South, the stakes are high. Digital public infrastructure and fair artificial intelligence are not luxuries, but lifelines for inclusive growth.
In the past, some of us who were not exposed to technology, computers, met them for the first time at university or so, but now as young as 5-6 years, we are already exposing our learners to this, and this put them at a better position to compete even at global level. We can see future scientists, future IT specialists from the exposure that we are giving our children.
The challenge for world leaders now is whether they will ensure a digital future that connects us all or risk leaving millions further behind. For Newzroom Afrika on Channel 405, I'm Malungelo Booi in Johannesburg.